We now move on to our second session, which is the micro-hospital model, a new blueprint for patient-centric care. This session explores how micro-hospitals can bridge gaps in accessibility, quality, and continuity of care. The session will be moderated by Dr. Swadeep Srivastava, co-founder and president, Pacific OneHealth. We will have panelists as Dr. Mohsin Wali, Padma Shri awardee. He's medicine and cardiology expert and former honorary physician to past 3 presidents of India. We'll also have Dr. Jagdish Prasad, who is a Padma Shri awardee, former Director General of Health Services, Ministry of Health and Family Welfare, Government of India. We will have Dr. Ejaz Ilmi. He's a physician and metabolic disease specialist. And we also have with us Ms. Seema Wilson, General Manager, Patient Care Experience with Pacific OneHealth. Together, they will share policy, clinical, and patient experience perspectives on this evolving care model. Welcome, everybody.
To start with, to set the ground, I would first like Dr. Jagdish Prasad to give his view, because I'll just tell a background about Dr. Jagdish Prasad. Dr. Jagdish Prasad is the ex-Director General of Healthcare Services, Government of India, one of the longest serving DGHS for about 8 years. He holds very important positions in various government committees. He's been part of policy making at the government side for more than 3 decades. He is one of the youngest cardiac surgeon who got Padma Shri at the age of 32 years. And the longest serving administrator, starting from Safdarjung Hospital to at a very important nodal position in Ministry of Health and Family Welfare. So with him, his type of experience, and particularly his initial years of healthcare in the side of government, how government healthcare is evolved, he has even seen a lot of such issues in Safdarjung, which because of his innovative approach, he was able to sort out many such issues with respect to the long queues of cardiac surgeries and a lot of other things for which Sir got Padma Shri, and his position in the center where he has seen healthcare from all sides, from the government, the private. He has seen the evolution of private healthcare in the last 3 decades, from being a charitable healthcare to converting into a very corporate driven and corporate dominated healthcare what we are today. So sir, we'll like to have your views on this and then we'll take the discussion forward. Sir, over to you.
Thank you very much, Dr. Srivastava. And ladies and gentlemen, August gathering, what challenge our country is facing today is a non-communicable disease. Because if 3 patients die today in India, 2 patients is because of non-communicable disease. And the concept which Srivastava has brought, and he's telling correct things today, the corporate hospitals, we are not able to regulate. Although the government of India, he asked me the challenge which we faced. We faced the challenge, we have made a Clinical Institution Act. When I became the DG in 2011, the act was passed in 2012, and then we made it 2014 to train all the people. Clinical Institution Act is the act by which you can regulate the all government, private, semi-private hospitals, where they can't go charging whatever they want. They have to tell, they have to put before, like if you have a renal transplant, if you have a urology surgery, if you have a cardiology surgery, everything has to be transparent. But unfortunately, no state has taken it. They have passed the bill, but nobody adopted under the pressure of corporate hospital. We have started the non-communicable disease program when I was the Additional Director General in 2010 as a pilot program. We are the first country in the world which we took non-communicable disease, and like HIV, the first world conference held in the Newark, where we were invited, all the prime ministers of the country, 131, 141. we went there in New York, how to prevent the non-communicable disease. And that is a great problem today we are all facing. And reason is that he has asked me one question, that how the public and government and private can help these problems. These are the big questions. So we have started the screening program. We have started the screening for diabetes. We have started the screening for hypertension. We are starting the screening for the asthma, cancer, for cervical cancer and breast cancer and mouth cancer. And so far till today, I just got the report from ministry. They have a screen 1 crore 6 lakhs in diabetes, 1 crore 6 lakhs in hypertension, 1 crore 6 lakhs in cervical and breast, and 87 lakhs they have done in diabetes. So far screening, and they are giving the treatment. And the government of India has formed the health and wellness center on every 5,000 populations, where they are doing the screening. The worst part of our country, not our country only, every country, even you take any developed country, the hypertensive drugs, antihypertensive, is not taken by at least more than 60% people. They think that once it is taken control, and that is one of the culprit to cardiac failure, culprit to renal failure, culprit to all the issue, all the problem. Same is true for diabetes. So these are the problem, chronic disease, which is creating the big house. And we were targeting that by 2030 we will decrease 1/3 of these diseases, but we are not able to do that. And tobacco is one of the cause, then lifestyle is one of the cause. Now the obesity has come one of the cause. So non-communicable disease. Now the concept with which OneHealth has come is one of the good thing, I think so, because in corporate the people get lost. Like suppose you are suffering from cancer and you need chemotherapy. Now you can get in such hospital daycare chemotherapy in the daytime, and if you get a good oncologist, medical oncologist, then you don't have to rush, and patient care 1-to-1. In our country, even the corporate hospital, like if you see the USA, if you go for treatment of cancer or treatment of even cardiac problem, not only cardiologist but cardiac surgeon, cardiac anesthetist, in oncology also, the oncology, medical oncology, surgical oncology, radiotherapy oncology, all sits together for a patient and discuss what is the best thing can be done. This is not happening in our country. This is a challenge, not happening in our country. So if cardiologists want, okay, we have to put the stand. Whether it is required or not required, or whether it can be treated medically, nobody knows. So this is the biggest issue in our country. Same way happens in medical oncology, surgical, because they don't sit together. They have to sit together. They have to decide about the patient. This is one of the challenges we are facing. Government of India to tackle because today challenge of us is manpower. Distribution of the manpower, rural versus urban. You will get the more doctors in the urban area. In the rural area, you will get much less doctors. Hardly, many less, and not a specialized doctor. Then, health is a state subject, not the government of India subject. Government of India is only facilitated. We give the money, we help them. Like during my time, we have made 20 state cancer hospital, and we have helped the private hospital also by giving 45 crore. Private hospital who is doing that, some charity, to be given 45 crore to them to build up infrastructures and treat some poor patients. Because in our country, the number of radiotherapy is much less. Because you require on every 1 crore population, 1 radiotherapy. But it is not there, so many radiotherapy. Like take for Bihar. Bihar has 13 crore population, I am from Bihar. Although I studied in Delhi, AIIMS, I am from Delhi since 1972, but I belong to Bihar. And if you see Bihar, because 1 year I was moving all around seeing their health structure from rural area to every area. No hospital ICU, there is no ICU, there is no cardiac ICU in the district hospital. Everybody looks to the medical college. This is the greatest problem. District hospital is not developed, CSC is not developed, PSC is not developed. And this is happening to many north state of the country. South is good. We don't get any patient from the south. But north we get lots of patient in AIMS, Safdarjung, RML, Loknayak, other hospitals. Even many private hospitals are filled with the Bihar, UP, Odisha, not from Madras, Karnataka, Hyderabad. Nobody comes here to get the treatment. So this is the one issue that a state who takes care is taking care. So what I was telling, that non-communicable disease has come up above the communicable disease. Once upon a time, infection used to be the priority, but now the non-communicable disease has become the main issue. Like one of the panelists was talking about the pollution to control. It is a big question. Pollution cannot be the way that we are buying the vehicles, the way we are using our style. They are making the building. Like if you make a rule, and even government is doing, they are cutting the trees and making the building and building. Because once you make one house, you should put 5 trees. But this rule is not there. So this is a problem. So pollution will remain there, because I saw one patient was operated by USA, one of my relatives, and the surgeon said that he's a smoker. I go, no, he's not a smoker. So, but his lung is completely black. So I say he's in Delhi. So he was surprised. So then I will operate him and he will go to again Delhi, or he should go somewhere else. So this was the story of everyone who is staying for last 50 years or 30 years in Delhi. Their lung has gone. If he is surviving because of his genetic. Because lung is hardly there. That I am just telling you. Pollution is so high. So because I think in 2018 I went with one of the relatives, and he has a robotic surgery, and the surgeon Didier Lomet in Langman hospitals in Newark, Dr. Prasad, this man smokes very much. He never. So, but his lung was totally black. We are staying in Delhi. So this may be the reason. So pollution, like pollution, smoking, tobacco, alcohol, lifestyle, although it has changed, but still people are suffering from non-communicable disease, and our government is doing maximum, but few things we are not able to do because we are not true to ourselves. Our community is not true. Community has to be true, transparent. Otherwise, we could have implemented the Clinical Establishment Act. No private hospital agreed for Clinical Establishment Act. And if you enter in one hospital, in corporate, you don't know how much money you have to give. Because I should not take the name of the hospital, although I have fought many times with corporate of Delhi, whether it is a Vedanta, or whether it is Apollo, whether it is a Max, whether it is a BLK. During my DG time, I have lots of arguments. So this is the problem we are facing. I think we have the concept with which Pacific OneHealth is coming is definitely going to give relief to such patients where it is a patient-oriented, education-oriented, and as Dr. Srivastava says, like patients are waiting and they don't know what has been done. You don't have time to tell the patient, बताता नहीं है. You have to communicate with the patient and patient relative. You have to tell everything to the patient, what you are going to do, what you are not going to do. And even if patient die, if you have well communication with the relative, every time you tell that this is the problem, when you go and show the patient, you should be transparent. Then you will not face the problem. Nobody will say that this corporate is bad. But we are not transparent. And because not transparent, because it is not fault of our doctors, it is fault of the master of the corporate who is running the corporate. They force the doctors to do this, do that. So, and we have become like contractor ask the laborer to make the building. So they have to make the building. And here the master says, surgeon, you do this, you do that. And we are doing that. I don't know how to control because we have failed. Because we have failed even in the BJP running a state to implement. Mr. Nadda has tried a lot because I spent long time as a Director General. I worked with Harshvardhan. I worked with Mr. Nadda 4 years, 2 years with Harshvardhan, and then 2 years with Ghulam Nabi Azad, since I was a long time Director General of Health. And everyone tried with the State Chief Minister to implement the Clinical Specialty Act. So in nutshell, I will not take time. In nutshell, I just want to say the micro hospital concept which Srivastava is bringing may be a starting, but it will give relief who is not getting relief from the satisfied from the corporate, especially for the day care. May not be for the staying in the hospital, but for the day care like ENT surgery, diabetic consultation, where you can have everything check up. Diabetic is not just diabetic. Diabetic people, because if you give education, diabetic patient has to get their regular eye checkup. They should get regular kidney checkup. And if it is a long-standing diabetic, you must get a cardiac checkup fully, because it is a slow killer. Diabetic is a slow killer. Hypertension is a slow killer. Atherosclerosis start occurring. And I can tell you very frankly, if you can control diabetic, you can lead normal life. But your hemoglobin A1C has to be less than 6.5. The moment you become more than 6.5, you will have a calcification in the coronary. Once it is 10 years, 15 years. So every cardiac patient, every diabetic patient should have this problem. So today our country is facing uncommunicable disease problem. In Bihar I saw why the patient died. Nowhere even the people know how to manage the ICU. Jaipur, SMS Medical College Jaipur. There are lots of things. Doctor has to be trained. Government is forming the medical college. This is not correct. One thing government is doing is we have opened the lots of AIMS. But what is the quality of the doctors we are getting? Well, I am a doctor, I am telling my profession, not satisfied. I am not satisfied. Which type of doctor we are producing? Or we are like Chinese? We are like Russian? So this is the problem. We have manpower is very less, nurses are very less, paramedical are very, very less. Not trained paramedical you will get, very less. So these are the number we are facing a special problem. And I will close my chapter. There are lots of things to talk to you people. Sometimes I will meet because I have long years in the, not only as a cardiac surgeon, but as an administrator also. In Safdarjung I was for 10 years as a principal director, 8 years Safdarjung. So there are lots of things in my mind, but everything we cannot do it. Whatever we can do to our level, I will only suggest Srivastava that you become more transparent as possible in your micro hospital. That is the only myself say. Good wishes, nothing we are going to take from this world. We will go free hand, nothing.
Thank you, sir.
So we should think like that.
Thank you, sir. Very pertinent points put by Dr. Prasad. And as he rightly said, our whole concept of micro hospitals, what we are going to set up is transparency. So that's where we are starting. So we have another Padma Shri doctor with us, Dr. Mohsin Wali, so much connected to this topic of patient care as it should be. I have seen Dr. Wali for the last 10 years, and I can bet on him that the type of patient interaction and patient care Dr. Wali practices, I think it's an institute in himself. A lot of practicing doctors, at least in Delhi, can learn with respect to the patient communication, the patient transparency, the time he gives to his patients, the problems he listens from, he addresses with the patients. His mobile is on from 8 a.m. in the morning to 10 p.m. at night. He is personally available to every patient calls, which is very rare in today's world. And particularly the busy private sector doctors, even the government sector doctors are not able to do that. So the level of commitment what Dr. Wali has for the patients is so inspiring. I would just like to hear from Dr. Wali about the current issues he sees in this medical practice, particularly with respect to the patient care.
Dr. Prasad, I have also had a chance to work with him under his leadership for more than 2 decades, and he was at the extreme of Safdarjung side and I was at RML hospital side, so we were sharing many things together. And I remember he has not mentioned 2 things. One is recently he had been advisor to Atlanta in a medical setup. And secondly, what was the initial days of Dr. Prasad work, this is part of my answer also, that's why I'm covering it, that he started doing cardiac surgery in those patients who were, we call them destitutes, very poor, and they had no place to go. He would welcome them at Safdarjung Hospital and do valve surgery, cardiac bypass. And that's why he got the name. So he started from the basics and he took care of the less privileged people. And that was the thing I remember about him, and I can say it with authority that what I said about him is true. Now, Srivastava Sahab is also doing something to bring things under one roof. And this is a very good concept, and the patient doesn't want to go from one doctor to another. This is what we call under one roof. But it should be coordinated. Now, what is happening recently, he asked me, what change I am seeing over 4 to 5 decades in practice is patients have become wiser and more learned than we doctors. This is very important. And their expectations have gone very high. So if we don't meet their expectations, straight away we are out, we are rejected. So that point one should always think, and then think about our teachers used to teach us, see the pocket of the patient. If a person cannot afford a costly antibiotic, write sulfarizine and it will work nicely. उस समय 6 पैसे की आती थी गोली, अभी भी आती है वो सॉल्ट्स सस्ते वाले. तो unnecessary investigations, unnecessary procedures, unnecessary burden of medical costs should not be put on the patient. Something more is happening nowadays. Some hospitals are misusing Ayushman cards. This is a recent tragedy. I would not talk about it because we are wise enough to deal with it. Now, second is patient requires time. As Dr. Sab has said, Sir has said, many speakers have said, we have to give the feel to the patient that we are giving time. How this can happen? Just say 1 or 2 sentences by which he gets connected to you. And once there is a connect between the patient and doctor, he will never go to any other doctor throughout his life. Just say a simple thing. Oh, are you from Bulandshahr? You have just seen in the address on the OPD card. But he would think, Doctor has associated me with my hometown, and he will get thoroughly connected with you, and after that you do what good you can do to him further. So these are the small things I have noted. Then economy is big thing which we should observe, because most of the thing Dr. Jagdish Prasad has told and most of the thing have been discussed, and Sudeep ji has also made a summary. Now, non-communicable diseases can be treated free if we start teaching our patients role of exercise in prevention of hypertension, obesity, diabetes, cardiac disease, dyslipidemia, fatty liver, and PCOD, things like that. So we have to inculcate in our patients that आप खर्चा नहीं करो, आप ये exercise शुरू करो कल से. I see one smart doctor sitting on that side. So he is posture, I can see that he is doing regular exercise. Dr. Jagdish Prasad has not put on even a single kilo weight since he was DG during my time. I have got the benefit of exercise in the past 9 months, and last night I thought a very important topic. I would write a book on obesity and sell it for 300 rupees, and उसका heading रहूँगा 300 रुपये में तोन दूर भगाइए, तोन गायब. सो जिस तरह की जो एक्सरसाइज है ना, उसकी हम बात नहीं करते. मैंने अभी बहुत बड़ी कार्डियोलॉजी की कॉन्फ्रेंस में डॉक्टर से खड़े होकर कहा, भैया तुम इतनी दवाई की बात कर रहे हो, सब कर रहे हो, एक 30 सेकेंड्स पेशेंट को एक्सरसाइज समझाने में भी लगाओ. ये नई नई दवाएं, कीमती दवाएं, हम कार्डियक फेलियर की डिस्कस हो रही थी, एजेक्शन फ्रैक्शन बढ़ाने की. मैं कहा भैया एक्सरसाइज की भी बात कर लिया करो. खैर, माई वन बॉस Dr. Santosh Kumar, when he came back from McMaster University, he told me the biggest asset, those days there were no mobile phones, the biggest asset and biggest आपकी कामयाबी का राज जिसको कहते हैं, secret of success would be your availability. So as Dr. Srivastava said, one should be available. Why not? If I am attending a party and some patient calls, I should answer the call and tell him, I'll talk to you later. So that kind of availability and sense of creating a positive response to the patient is also very important. Well, there are administrative issues, availability, insurance, these are variables. So what I would like to summarize is that medical profession can still be well respected. We have lost the respect of medical profession quite a lot. So if we remember what our old teachers have taught us, and we inculcate in our juniors and we teach them in the medical college, medical profession can still be the best respected and best suited for the children to adapt. Now I am seeing children are not going medical profession, that's why I am saying this. And then transparency is a big issue which should be maintained. And I thank Dr. Sudeep that he has got this concept of Pacific OneHealth, maximum care under one roof. This is a big and great idea, and patient would be relieved. I say sometimes in my talks that we have divided human body into specialties and super specialties. So there is a separate hospital for 700 gram heart, there is a separate hospital for 1600 gram brain, there is a separate hospital for 30 gram eye, there is a separate hospital for 120 gram kidneys, there is a separate hospital for 1600 gram liver and biliary system, roughly. So we have to come back, and that is why if these we allopaths want to maintain our ruab practice and existence, finally हमको ऐसा करना पड़ेगा कि हमको होलिस्टिक अप्रोच अडेप्ट करनी पड़ेगी. नहीं तो दूसरी पैथी के लोग झंडा लेके खड़े हैं हमारे खिलाफ कि इनकी दवाओं से रिएक्शन होता है, हमारी दवाएं सेफ हैं, आप हमारे पास आइए, हम भी आपका आयुष्मान कार्ड से इलाज करेंगे. और वो शायद कभी कभी ज़्यादा पैसे भी ले लेते हैं हम उनसे. तो हमको बहुत, ये हमारा जो पीरियड है, डॉक्टर साहब माफ़ कीजिएगा, आपके पीरियड में सब नहीं था, अब बहुत ख़तरे वाला पीरियड आ गया है कि हमें बहुत सतर्क रहना है कि हम जो भी मेडिकल सर्विसेज दें अपने ज्ञान, विवेक और ईमानदारी के साथ दें. ये बहुत बड़ी बात मैं कह रहा हूँ, थोड़ी इमोशनल होके भी कह रहा हूँ. तो ये बहुत ज़रूरी है. मैंने तो शायद, आपने तो शायद कर लिया, आगे आने वाली जनरेशन्स के लिए बहुत अच्छी बात है ये कि हम अपने प्रोफेशन को लेजिटिमेटली, ट्रांसपेरेंसी के साथ और बहुत ईमानदारी के साथ करें. मैं आपसे हलफिया कह रहा हूँ ये बात, आई कैन swear through my heart, by my heart, that अगर हम ऐसे ही नियत से काम करेंगे तो हम सबसे पहले तो सबसे ज़्यादा रिस्पेक्टेड फिर भी रहेंगे, लेकिन पेशेंट को हम खोएंगे नहीं। आज पेशेंट परेशान है, मैं कहाँ जाऊँ कहाँ जाऊँ कहाँ जाऊँ कहाँ जाऊँ, गूगल सर्च करता है, दोस्तों से पूछता है यार वो डॉक्टर कैसे हैं, वो कहता है मैं तो जानता नहीं, दूसरे से पूछता हाँ अच्छे हैं, तीसरे से पूछता हाँ बहुत बढ़िया है बिकॉज उसने उनसे ऑपरेशन का, चौथे से पूछता है भाई पता नहीं। तो ये वाली रेपुटेशन नहीं होनी चाहिए, हम सबको बहुत अच्छी रेपुटेशन बना के चलना है और कामयाबी हमेशा साथ होगी, यही मेरी दुआ भी है, एडवाइस भी है।
So Dr. Wali is as truthful as he can be, and he is like that. Thank you, sir. Thank you for giving your perspective in a very bold manner. Since Dr. Wali has covered the metabolic disease, now Dr. Ilmi is very eager to give his point of view on particularly, sir. My question to you is what Dr. Wali also raised, that the preventive health aspect, whether it is health education for physical activities promotion, or for good nutrition, for good mental health. So generally all in this corporatization word, this is become gone, it's not a priority at all. If you look at all the big hospitals, I think they have set up a department of preventive health check, but nobody is actually focusing and doing the work the way they should do. And even the doctors individually are so busy in their daily medical practice that they are also not playing their role in patient education, in health education, in preventive health, creating awareness about prevention than cure. Everybody is talking about illness, nobody is talking about wellness. Very few people like Dr. Ilmi and Dr. Wali and few such experts have actually come forward, and they always raise this point. So how that can be changed, and what is your perspective on that, Dr. Ilmi?
So my basic interest has always been that the number of doctors can rise, but the consumption of medication is rising faster. And faster than that is the rampant rise of all non-communicable diseases. So there has to be a missing link that we are not addressing. And in my idea, in my practice, what I use as a metabolic reset is something that focus has to be on reversing your metabolic dysbiosis and dysconditions. Then only can you provide the missing link for the pharmaceutical interventions to be actually effective. Because if you don't fix the micronutrient deficiencies, and if you don't read like a detective the various blood reports and see trends of various important things like the liver enzymes, uric acid in the KFT, your protein intake, the different metabolisms, pre-diabetes, rising insulin levels, high cardiac risk factors, and something which we didn't do in our time, which is very evident now, is all disease now is at a cellular or a subcellular level. There are about 8 different pathologies which are progenitors or which start disease of all non-communicable diseases. It's linked to nutrition, linked to malabsorption, linked to your metabolic profile and your metabolic dysfunctions. So it starts with glycation, which is obviously rising blood sugar levels, pre-diabetes, diabetes, that's glycation. If you have glycation, your oxygen carrying capacity will be reduced. You will not be able to get adequate nutrients, and you'll have micronutrient deficiency, the most common of which is serum iron, vitamin D, and lower levels of magnesium and zinc, which are very essential for various enzyme, chemical, and nutritional pathways for your system to work at an optimal level. Secondly, what happens, that's called the trifecta of nutritional deficiency. Second comes, which is very important, which is largely genetic, and you don't have to be predestined if you have a thing called a methylation defect. It's called methylation. We don't check the serum homocysteine levels. Besides heart disease and diabetes, the other risk factor for strokes, which is happening earlier and the younger people are getting affected. In my practice, I'm noticing 30 to 40% of youngsters and people below the age of 60 have very high homocysteine levels, which is basically you're not able to convert something, lack of methylation, and which is causing vascular disease, stroke, and this is something that needs to be addressed and should be a part of your all the tests prescribed to you, your biomarkers. This is something that needs to be assessed. Secondly, doing body metrics analysis is very important. This is simple measurement of a mid-waist circumference. If it's more than half of your height, it'll give you an indication of central adiposity, that is collection of fat. We have, every corner we have a gym. The youngsters are going to the gym. So it's called trophy. You're thin outside, fat inside. But if you have just a pound of extra fat deposited on your liver, then your liver enzymes begin to show up. So these trends indicate that non-alcoholic fatty liver is far more prevalent, and even the AIM study says that children from the age of 6 to 19 who they evaluated, every fourth child in NCR in private schools has some sort of medical or metabolic deficiency, or right from pre-diabetes to diabetes, and showing HSCRPs of 6, 7 in young children as young as 7, showing signs of hypertension, showing signs of overweight and obesity. So non-metabolic, non-BMI interventions and awareness and integrating all this is something that Pacific OneHealth is also speaking about. The idea is to be proactive, preventive, personalized point of care, and also be profoundly human and humane in your dealing with patients. A patient has to be seen thoroughly. He can't be processed like the processed food industry, like we all suffering with 30,000 new products in the last 20 years, which is causing havoc of metabolic diseases. Don't process the patient. Let him be seen, heard, spoken to, listened. Give him a time-enriched consultation. Tell him what causes disease. Explain to him with evidence-backed, and also give him the solutions at what can be done. Once you identify biomarkers and you know that non-communicable diseases are there and its trends are going up, intervene at the first stage, because you as a physician, as a clinician, with your expertise, utilize your empathy and your expertise to inform the patient, make him scientifically aware of what is happening to him in terms of the cellular pathologies, provide the corrective mechanisms, interventions, and also if he needs a personalized follow-up, do that. But please give him time. He just can't be seen as somebody who's seeing you for 5 minutes and being processed. He has to be seen, heard, listened to, and spoken to, and explained to, and scientifically empowered, because a doctor can't do his complete responsibility unless the patient shares his responsibility with the doctor. So these are the imperatives. I was asked to speak about what causes NCDs. Well, it's so evident. It's so evident that we have, evolutionarily, we are not used to the new food order that is prevalent in the country. High usage of ultra-processed food, 30,000 new products. The Swiggy Zomato syndrome. If you can get order food available in 10 to 15 minutes, I think you're not doing your job, not cooking enough at home. I mean, parents are busy, but the responsibility of parents towards the children is equally important, making them understand that you have to minimize your intake of added sugars, sugary drinks, because all processed food ultimately has coloring agents, additives, emulsifiers, which also act as endocrine disruptors. For women setting out here, it's so important because 50% of the autoimmune disorders, especially thyroid, are happening in women, and because it's a travesty of nature. What do you say? But the reality is that you have to be sensitive, because where they're looking at corporate wellness, the large number of women who work in the corporate wellness sectors and as business leaders, they have an issue of perimenopausal issues, work absenteeism, with the the cycle of periods getting disrupted and losing out on office hours, tending to the family. So all these things combined, the 5 key things that are there is look at real food rather than processed food. That is the first thing. If you can do that, even 50%, 80%, you are likely to get more absorption of nutrients, get your parameters all right. Second thing is complete lack of fiber in the processed diet that we eat today. Everything right from the processed seed oil industry, it's refined. It goes through 6 chemical processes, including hexane. So what happens is all the fiber that is there, given by nature, evolution, in the seeds, in the leaves, is largely depleted, and you only have omega-6 inflammatory kind of seed oils which you are using. So the third most important thing at the cellular level is inflammation. So all disease is inflammation. You can have chronic inflammation that leads to all these diseases, but that is again linked to your metabolism and your nutritional status, which includes glycation, methylation, insulin resistance, mitochondrial dysfunction. We don't talk about the mitochondria at all, which is the powerhouse of energy. The function of mitochondria is to convert food to energy or food to growth. If the mitochondria is dysfunctional with higher uric acid levels, because of higher intake of processed food and purines, you are going to be overweight, your fat cells will get larger, you're going to get hypertension sooner, and then you're headed towards downstream disease, which is around the corner. Because the disease is not waiting for you. It's you who has to take out time to get yourself assessed and move on. And that's the way. Secondly, early mental screening has become a very important thing, because we talk about anxiety, stress, brain fog, but this is a continuum where the continuum goes right from here to Alzheimer's and Parkinson. So see them early. Anybody with 40 with biomarkers not in the range that you think they're having these cellular pathologies, get them screened. Do a mental cognitive examination. You have the mental cognitive assessment protocol. You have GAD, which is, you talked about other parameters. So you've got to have trained people who can give these questionnaires. So under one roof at Pacific OneHealth, we can address all these issues. A patient has a far richer experience. He gets the time that he needs. You get the time to evaluate him through detailed history, read his reports clearly, advise him correctly. I think that is the way the future is. The future, like Dr. Wali spoke about, various grams of 1.6 kgs of brain, 120 grams of kidneys. So we're not just a bunch of organs in one body. What is more important than the bunch of organs is the network that connects all these systems, the blood vasculature. We have 1 lakh kilometers of blood vessels if you take all the capillaries, everything out, that means rotating around the earth twice. So that is the amount of blood which carries oxygen, substrate, food, enzymes, vitamins, hormones all over your body. So if your blood vasculature and your nervous system is impacted, your myelin and membrane instability is happening, then you're working at a suboptimum level, and then you are inviting disease to come earlier than normal. Now we have early onset cancer. We've been the diabetes capital. We are fast becoming the cardiac disease capital of the world. We are going the way the sad American diet took America, and the UK has become the fat man of Europe because they also follow the same system. And we are also headed in the same direction. If you see the AIMS report, with having every fourth child in private NCR schools suffering, and we can't do much about epigenetics in terms of pollution, because that is something beyond us. We can just try and protect ourselves. The water the government provides, we can use air purifiers at home and water purifiers. The only thing that you have control is what you put in your mouth, and that is 80% of what can save you from the big food industry, the big pharma industry, and everybody who's out to profit from your dysfunctions. And ultimately, it reflects on you. It impacts the public health system. It impacts the economy of the country, because the public health care cost goes up. More funds have to be attributed. And this is where all of us need to get together and work on a mechanism where we understand that fixing the network is equally important than just fixing the organs. Because the network is going to provide the nervous control, the blood vasculature, the blood flow. All these things are equally important. And I'm very grateful to Dr. Sudhir for giving me this opportunity.
Thank you, sir.
And we intend to do such activities. Preventive care, which is predictive, proactive, and profoundly humane is the way to go. And I think the future of healthcare is prevention, as Dr. Jagdish profoundly explained to us about non-communicable diseases. Well, I refer to them as largely metabolic diseases, nutritional diseases. I think that is the missing link that we need to address also, along with all our super specialists and seniors, that we have to find out the missing link and focus on that, and have a detailed question and answer session with the patients. Make him feel comfortable that you care. Then only is the patient going to come back to you, and you can do maybe a thorough, holistic job of giving him relief from pain, fatigue, brain fog, and mental decline. Thank you so much.
Thank you. So, probably at Pacific OneHealth, we are going to be the first hospital in the country that, before launching our micro hospitals in March 2026, from January onwards, we are already starting with our wellness programs under Dr. Ijaz Ilmi, Dr. Mohsin Wali, and a lot of other leading experts. We are rolling out our corporate wellness programs, our school health programs, a lot of other integrated wellness programs we are going to start from January, and we'll keep updating all of you. Now, coming to the very interesting topic of neurology, we have Dr. Manish Sinha, and Dr. Sinha, neurological disorders, neurological degenerative diseases, the neurological psychiatric problems. So all these problems are growing so fast. Probably it has caught my attention while I was doing all this setting up of various departments at Pacific OneHealth micro hospitals, that this is emerging as one of the biggest challenges for the community, that is neurological disorder management, because of not that experts are not available, but dedicated clinics, centers, integrated centers are very few. And the most important fact that patients of neurological disorders come into a stage where they are themselves suffering from such a disease which makes them weak. Second is they are at that juncture of their age, maybe above 50, mostly above 60 years, 65 years, the elders, that they are already so psychologically weak, and then they start suffering from disease. And if they don't get a proper family support system, the suffering goes higher. So in this scenario, sir, what is your perspective? How neurological care should be as it should be?
Thank you, Pacific OneHealth. And I am pleasantly surprised and happy that this hospital or micro hospital is focusing more on prevention along with the treatment. And I'm really honored to be sharing the dais with Dr. Prasad, Dr. Valli, Dr. Elmi, Seemaji. Yes, as you just mentioned that neurology or maybe the neurological diseases are diseases of 50 plus people, I would disagree. Actually, the neurological problems are now becoming as common as youngsters and even children. So earlier neurology OPDs would be filled with people of say 60 plus people. When I was doing my residency, as maybe in early 2000 and 2010, the number suddenly shifted towards youngsters, mainly these young tech guys. And then because as the jobs and the working shifted towards IT sector and sedentary activities, earlier people would go to factories and go to work in field and maybe would be more mobile. Then people became more shifted towards sedentary jobs, desk jobs, office jobs, white collar jobs started being called as the smarter jobs. So work smarter, not work harder. So things suddenly change. And over the last 20 years, I would say that the number of patients, the age group, if we consider, I would say there are children in the OPDs, then there are more number of youngsters, maybe in 20 to 40s, and the number are almost similar in other age groups. So why these things have suddenly changed? So as Dr. Prasad and Dr. Valli and Dr. Elmi mentioned that these are some lifestyle diseases, and neurology is actually now more becoming part of that non-communicable lifestyle disease. And so if we just simplify what brain needs and why brain becomes disturbed. So brain is if you simplify it, it requires basic 4-5 things. Like we need basic 4-5 things in our house. We should have constant current, and then constant water supply, constant ration supply, and air supply, so there should be proper ventilation. Similarly, brain also requires very few basic things like a constant current, which is called alpha current, which is generated by our brain thalamus, and then there should be proper circulation in the brain. Then second, blood flow. The blood flow has to be constant. When the blood pressure goes high, or in certain condition when the blood pressure goes down, then brain start malfunctioning. Then third is I would say hormones. So brain also requires a lot of neurohormones like serotonin, dopamine, endorphin, and then there are some other stress hormone like adrenaline. So sometimes the interplay of these hormones. And then glucose. Glucose is the power, like is the fuel of brain. So if you start interfering with the glucose system in the brain by not having the meals properly, or maybe skipping the meal, or having intermittent fasting or something, then you also start interfering with the brain function. And then air. So if you are not going out in the sun and doing regular exercises and get yourself some air, you start having neurological diseases, and then there are postures and all those things. So these are the basic things, not very difficult to understand, very basic common sense things. So how things have changed? Like the major change has happened is that people have started spending more time on screen. So screen time increase has actually changed a lot in neurology or in people's lives. So right from childbirth, even at 1 year of age, most of the children, especially those who were born during COVID and post-COVID time, they are now glued to screen. So they have their own dedicated iPads. Now they are being called iPad babies. So iPad, and they will be learning their rhymes on phone or TV. They will be eating their meals or food in front of TV or screen, and then they'll start having online classes, and then start playing games online. So there will be some social isolation as well. Then as they grow up, they start looking for jobs which are also on screen. So they will be having some IT jobs or tech jobs. Most of the jobs will be on screen somehow. And as they mature, or maybe when they grow old, again their children will give them iPad or something to watch, or maybe watch bhajans or maybe Ramayana or something on iPad. So that screen time goes on and on. Now screen time actually interferes with our body system, because screen is actually a source of UV light. Now UV light comes from the sun. Even these LED lights also have UV lights. Brain is not like this. It has been evolved over 2 or maybe 3 lakhs years, or maybe more than that. And we were always diurnal people. We used to get up, our forefather used to get up in the morning when the sun rose, and then go to their caves or maybe to their homes when the sun set. So we were all actually timed with the UV light and sun. Now with always on screen, your UV light is always coming to the brain, so brain does not know when to sleep, when to shut down. Now that interferes with the neurohormonal system, and you start having headaches or maybe stress. So the serotonin, dopamine, the circadian rhythm is all based on the UV light and the sun exposure. When you interfere with that circadian rhythm actually changes your metabolism, body metabolism. Then you do not know when to sleep, and our many hormones, like even thyroid hormone, is actually linked to sleep. So if you are not sleeping at the proper time, you may start having thyroid issues. And then so one is screen time, which actually interferes with our sleep-wake cycle, and also actually makes us isolated from people. It also prevents us from going out and get exposed to sunlight, and sunlight actually is good for health in some way, that you get like vitamin D conversion in the sunlight, and then you meet more people, and then your sleep cycle also gets controlled by that. And apart from that, and then you become sedentary, you do less exercises. So yes, one is screen time, I would say. Then interference with the sleep cycle, which is also related. Sometimes people are not on screen, but still, because the light has changed, like the advent of light, like when there were no light or no electricity in the society, people would actually usually sleep by 7 or 8, and 10 or 11, very few people would be awake. Only thieves or people who are not good with the society would be awake. Now
everyone is thief.
Nightlife is so thieves and so looters will be awake at that time. Now most of people will be awake at 11 or 12 or maybe. And then apart from that, I would say diet. Diet is again a major issue now. It has started including more of added sugar. And sugar, if you notice that if you have a pet dog or some animal at home, your vet will forbid you to give sugar. But as human beings, we eat a lot of sugar. And I don't think many animals can actually absorb or maybe digest so much sugar. And we also eat, like Indian diet also contains a lot of fat, saturated fat, and we are actually very obsessed with masala. And if you put masala in kadhai, you have to add oil, and you have to actually cook that masala before you saute other vegetables.
Thank you, sir. Sorry, I have to cut it a little short because we are getting late for. So, sir, I request you to conclude.
So it's mainly the screen time, I would say, and then sleep cycle, diet, then exercises. So exercises, I would say that it's better to go out and do some sports along with physical activities, outdoor physical activities, because in gyms mainly you get only recirculated air, and in a closed air conditioned gym, when you go out you get actually exposed to more oxygenated air, you meet more people, you see people playing and having positive vibes, so that will actually add to your mental health. And then alcohol and substance abuse and smoking, those also have to be actually modified accordingly. And then pollution, I would say pollution is adding to neurological diseases. Many of these pains, joint pains and nerve pains are actually contributed by some of the reaction, or maybe owing to reaction in the air or water.
Thank you, Dr. Sinha. Thank you so much for this. I think the most relevant topic, relevant way to close this session would be to hear from Mrs. Seema Wilson. We have created a separate department called Patient Care Excellence, which is not very much prevalent in the hospital practices, I have seen, but we have created a very dedicated department called Patient Care Excellence under Mrs. Seema Wilson. She has got more than 3 decades of nursing care experience at the care side, but a huge experience in the last decade with respect to working with NABH, NA and other such Quality Council of India and other such quality oriented systems in India in terms of policy making, and how to improve the quality of care is been her expertise, for which we have requested Mrs. Seema Wilson to head this department. So your concluding remarks on the current patient challenges, and what do you see how patient care as it should be?
Yeah, thank you, sir, for giving me this opportunity to speak and represent the patient, the perspective. Till now, we all are talking about the diseases and the hospital, the setup. But anyhow, the hospital setup is not only made for the bed numbers or the machine. This is basically made for the person and the patient-centric approach. So if I'm talking about the patient perspective for the healthcare service, if we ask the patient how they perceive that the healthcare sector should be, so from the patient perspective, the first and the important thing which they say is that I want the individualized and the empathetic care, which is nowadays, I think if we go to the public hospitals or in the corporate hospital, we all know that what chaos we all are facing while standing in a big queues. Even if we go to the teleconferencing also, and we want to get an appointment on the phone also, we are getting a long, the queues, we are getting a long waiting times, like, for a 2 months waiting time for the doctors for getting the approval. So from the patient perspective, they want the empathetic and the individualized care. They want a precision sort of, the medicine nowadays. They want that they should not be treated like a patient as a, as a whole, like, as a standard treatment. They want a genomics type of medicines nowadays. They want that they should be treated like an individual. Their system should be treated like an individual. They want coordinated care. They don't want to stand in a big queues and all. They want the processes should be, the shortened. They want that the doctor should not impose the treatment plan on them, but the doctor should give them a proper advice. The doctor should give them a proper preventive and the follow-up, the advices which actually they want is. Presently, if we just see the patient's point of view, they don't have a money problem nowadays. They are ready to pay, but they don't want to compromise with the qualities and all. They want to avoid the big queues and all. So they want to take appointments on the phone. So they want that once they reach to the hospital, they should be received with a smile. But if we go to the public hospital and the corporate hospital, because of the long queues and all, this is smiling and the personalized approach is totally absent nowadays. And the patient who is an individual patient, they're already having a more anxiety in their mind, So once they entered and they are treated like, and they lost in the big crowd, so they are more anxious, The nurses are in a chaos. They just take a vitals like a machine. They are not taking a proper histories from the patient, and that is the point where the patient lost the trust, from the hospital and from the doctor. The doctors are taking it just like, the patient, not as an empathetic approach. So presently, when there are more diseases, the patient want a personalized care, individualized care, well-coordinated care. And I think this micro-hospital model, I think this represent bold, the shift, what exactly we imagine the healthcare sector should be. This is not a future of the healthcare, but this is really a blueprint of the healthcare sector is. And patient is the main person of the hospital, but we are always talking about the number of beds, the big infrastructures and all. But we are just forgetting the trust of the patient, which actually the prime responsibility of the doctors and even the nurses and all the paramedicals who are attending. So I think this micro hospital, they are able to cater all the essential services under one roof, and I think the patient will get a more personalized care. And this is my personal belief that this is really, I think, the real blueprint of the healthcare sector should be. And the patient satisfaction index, this is the one matrix which I think presently every hospital should have to adopt. And this is not only to take just a simple feedbacks from the patient. This is to analyze where they are lacking exactly. This is a gap analysis which they have to do, where the gaps are, why the patients are not coming back, why the patients are only coming only one time to our hospital, why not the second time or the third time. So this is the big question. The patient-centric approach is totally missing nowadays in the healthcare, maybe due to the precedented, the pressure on the healthcare, or maybe the shortage of the manpower. But in the corporate hospital, this individualized care is totally, I'm not saying that it is going totally, vanishing, but yeah, we all are becoming just like a robots or, the machines nowadays. We are forgetting the empathetic approach, which exactly the demand of the patient is, the therapeutic is nothing, it is just like a therapy. The patient, this is our, I think, misconcept. I don't know whether the doctors agree with me or not. The patient will not heal with the medicines. What I feel is, the main healing comes from the inner side. When the patient is attended with the empathy, and doctor will listen carefully, the doctor and the nurses will do the proper initial assessment of the patient, they do the risk analysis, they take the allergy history of the patient, they do the preventive, the sort of thing. With this empathetic approach, I think the half of the illness will definitely go, and rest will go with the doctor's treatment and all. So if we go to the patient satisfaction index, it comprises of the 4 elements, and it gives the 4, the 5, the points 1, 2, 3, and 5. So we have to ask the patient how you feel about the services, whether the services are okay, you have to stand in the queues or what, something like. And then the second comes is how well your treatment is coordinated to you, communicated to you, whether the nurses have explained to you properly or not. The third point comes as, the atmosphere. The patient don't want very, the hi-fi infrastructures. They want a very calm and quiet atmosphere. They don't want to spend their times in a big queues and all. They want that they should be attended well. There should be a "may I help you" desk and something. So patient should be attended well, and they have to escorted till the gate also. And then they should be advised about the next follow-up visits and all. So that is basically the demand. We have to treat the patient like a human being. So this is called a human approach. Precision medicine, a genometric approach of the medicine. Even the NABH Quality Council of India, once they are taken out the sixth standards, the sixth edition of the accreditation. The basic concept is the patient-centric approach. They are emphasizing the hospital that they have to take up patient-related outcome measures. They have to capture the patient-related experience measure. They have to ask, they have to involve the patient in their decision making. The clinical counselings are very important. They have to the multidisciplinary approach. They have to call the patient and the relatives in the room, and they have to coordinate and they have to discuss with the patient how they have to take it forward. So I think this micro hospital able to, cater all these services, and they are able to take it to the community. That is my personal belief.
Thank you, Mrs. Wilson. Thank you. I think you spoke on our behalf and you covered most of our points also which we wanted to communicate. Broadly, our concept is to come up with smaller dedicated 50 beds, 60 beds hospital where we have multidisciplinary approach, but we are able to give lot of attention on patient-centric care, whether it is with respect to the nursing care or the reception at the front office or attending each and every patient personally who walks in, removing the waiting queues, bringing in more transparency by having counselors and communication expert within system at every level, taking care of the efficient discharges at the hospital, in reducing the average length of stay and so that patient gets discharged further, or implementing the continuity of care in the form of home health care and other rehabilitation services what we are offering, and even starting with the preventive aspects of care where we are going to focus in a big way in terms of not only for the people who walk in for preventive health checks, but even our own outreach program of going to the communities. We already have a mobile screening van which is going across Delhi into communities doing free NCD basic 20 parameters checks free of cost going across in different RWs and community. We have got a team led by Mr. Sanjeev Paul and medically headed by Dr. Ilmi, wherein we are going out to the corporates. We are launching our own dedicated school health program because intervention of healthcare is so important, school level also, which is again missing in which is again the missing link. So there are so many missing links which we are trying to connect and cover in this program of Pacific OneHealth micro hospitals.